So here is a short insight into our IKN approach to movement, injury and pain rehabilitation that we teach to thousands of practitioners across the world. So any well-rounded rehabilitation approach will consist of three basic components. So firstly, you have your assessment process, where you're assessing the unique individual and you're gathering information, both subjective information and objective information. And within our IKN approach, we have a step-by-step process to ensure that we gather quality information to help guide the rehab process. Now, the second component, and this is the component that is most often overlooked, is the sense-making process. How are you making sense of the information that you've just gathered from the assessment process? And how are you using that information to guide what you do during the third component, which is the actual treatment and rehabilitation strategies that you choose to utilize to reduce pain and to get your clients back to their goal tasks? Now, within our IKN approach, there are three main models or concepts that we use to filter this information through. And these include coordination variability, biomechanics, and applied neuroscience. So let's explore each of these concepts because this is really what we feel makes our approach different and will directly influence how you go about selecting your treatment, your movement, and your rehabilitation strategies. So first up, coordination variability. Now, coordination variability is an area of research that explores the interaction between segments of our body during specific tasks. And it offers us a very unique perspective on how we can go about influencing someone's movements. And one key characteristic of this concept is the relative movement between joint segments during specific tasks. And generally what is found across this research is that in individuals who are experiencing persistent pain or persistent movement limitations is that they have less relative movement between interacting segments. And this is often described within this research as an in-phase pattern. And alternatively, when segments can move relative to each other, where there's more space between those segments, this is often described as an anti-phase pattern. And we use this research, plus much more, to help make sense of someone's movement during the assessment process, but also during the rehab process to ensure that we're promoting increased movement options to help facilitate more pain-free movements and to get individuals back to their goal tasks. The second model or concept is biomechanics. Now, this can often be a daunting area for many, but within our IKN approach, we really simplify biomechanics and mainly use it to help inform us as to how someone is interacting with forces. Because this is something that all our clients will deal with on a day-to-day basis. They are always dealing with external and internal forces. And so understanding this can help us make sense of the strategies that they're using when they move, as well as for us, how we can be more mindful with the movement and the rehabilitation strategies that we give to them throughout the rehab process. And lastly, we explore the world of applied neuroscience to consider how the nervous system influences the way an individual moves and interacts with forces. Now, this again can be another daunting area for many, but again, we simplify it massively on our courses to make it extremely practical during the rehab process. So as an example, different parts of the nervous system will have more control over certain parts of our anatomy. So if we consider the limbs versus the midline of our body, the lateral parts of our nervous system will buy us more control over the limbs and the distal parts of our limbs, like the hands and feet in particular. And the medial parts of our nervous system will control the midline more, around the spinal column, for example. Now, the lateral parts of the nervous system will buy us more conscious, voluntary control, while the medial parts of the nervous system will buy us more subconscious control. And so, for example, if you have a client with persistent low back pain who may move with a lot of conscious attention around the low back during multi-joint movement tasks, this may disrupt that neurological control pattern. So a key part of the rehab process may be to allow that client to shift more conscious attention distally away from the lumbar spine into the lower limbs and the feet through specific exercises to help encourage more subconscious control around the proximal region around the low back. Now, of course, this is just one example of how applied neuroscience can influence what we do, but again, it's often an overlooked area. Now, like we said, these concepts simply inform and guide how we can make sense of the information that we gather from the assessment process, but also they help to guide actual treatment and rehabilitation. And once we get to this part of the process, we have a step-by-step approach to choose the most appropriate strategies for that unique individual. And because we are movement practitioners, we are all in the business of stress application, meaning we apply load, force, stimulus and stress to our patients' bodies, using our hands or manipulating their bodies against forces and resistance with movement and exercises, or even using our words through education to help influence how they're moving and interacting with forces, all to achieve a certain goal. And that goal could be to expand range of motion at a certain joint, to build contractile tolerance to load through a certain muscular tissue, or to help a client coordinate muscular and joint behavior across a multi-joint task. So the key with our IKN approach is having a clearer understanding of how we are applying that stress and load, and then why we're doing it in a certain way. And then also being able to adapt and adjust when necessary as well. And this is why having a sense-making process is key, because it allows you to have much more clarity in your decision making to arrive at a certain exercise, a movement or rehab strategy. Because in our opinion, this is the process that separates average practitioners from world-class practitioners that can adapt and adjust when necessary. So if you want to explore our IKN approach more and integrate it with your current approach as a movement practitioner, be sure to check out our website for upcoming courses, or feel free to reach out to us via email for more information.